Hey guys, welcome back to another episode. We're now on episode two, and our theme for today is surviving prostate cancer in Jamaica. And here we have two survivors, Mike and John. I'll let them introduce themselves. Mike, you can go first.
Hi, I'm Mike, survivor coming up to 13 years. And just giving God thanks for continued life and health. Uh, my journey started some time ago when I would usually do my checks, and I'd stop for a while and then bucked up with an associate one day who just said to me, "Hey Mike, I'm going through this thing with my prostate, and have you been checking yours?" At which time I told him I kind of stopped for a while, and then I started again. And then a couple years after that, you're checking like annually. Um, I noticed at times there was an urgency to urinate. And, I'd said that to my urologist, and he started tracking the numbers, of course, for the PSA. And they started trending upwards from where my original baseline was. And of course, did the DRE in addition to the PSA test and said, okay, fine. We're going to monitor it a bit closer now. So I moved from 1 year to 6 month checks. And after the second 6 month check, he said to me, "No, Mike, it had stopped for a while. In fact, the readings actually went down and then it started moving again. At which time he said, well, okay, we're going to do a biopsy now, and then we'll determine the outcome from there." Went ahead and did a radical prostatectomy in September 2010. That's basically my journey.
Thank you, thank you. And John?
I'm Johnny. I am a prostate cancer survivor. My journey started in February 2021. I did an enlarged prostate, so I had regular visits to my urologist. But I had visited I was taking a certain medication to help to reduce the prostate, so I wouldn't go out to the bathroom much. But when I visited my my GP, it was just to do my cholesterol. But I tell him to throw in the PSA into it, because just like I don't like the sticking of the fingers, so that's the one thing,
Understand.
And so when my results came back, my PSA had jumped dramatically, So when I visited my urologist, I usually do my digital. Everything was the same. There was no tumor that was felt, no uneven surface. But he recommended that I do an MRI. The MRI showed that there was small areas that had abnormal cells. And so therefore that led us to do a biopsy. But while doing the biopsy, the ultrasound didn't show any unusual, swelling of the prostate or anything like that. But what happened is that when he finished doing the areas that the MRI showed, he decided to do outside that area, And so when the results came back, there was a small area of, that was cancerous. And the Gleason score was an high one, but, it was recommended that, it wouldn't be good to wait and watch, because a 4+3 means it could get a bit aggressive in the future, So that is how my journey started,
Okay, thank you so much, both of you, for sharing that. So my next question goes straight to John as the recent diagnosis. Where did you go for treatment and screening in Jamaica? And can you tell us a bit about the emotional journey throughout the process?
Well, as I said, I had my urologist, Dr. Trevor Toller. I went for my MRI. I don't remember the place on Hope Road, but and Dr. Toller did my biopsy. I up to do radical prostatectomy. So but I choose to do robotic,
Right.
and so I traveled overseas to Dr. Chadrich at the University Hospital of Miami, you know, and that is where I did the treatment. I must be truthful, it wasn't such an emotional journey because, you know, I started reading up about it and so on, you know. So with encouragement and support of friends and family, I mean, I was more or less in a good frame of mind, but it's something what had worried me more than anything else. You know, I wasn't worrying up at that time about any side effects or so on. It was during COVID, so you're more worried that, boy, you know, you may contract COVID and, you know,
Yeah.
it made it worse, you know. But yes, there was some emotional, you know, I mean, thoughts, but nothing to really throw off my days, you know.
Right.
With prayers and support from friends and family, you kind of, fortify yourself for the journey. Yeah.
Right. And would you say that your cancer diagnosis affected you and your family at
Beg your
all?
pardon?
Would you say your cancer diagnosis affected you and your family? Did it affect your family life or?
No, it didn't. You know what I mean? It did not at all, you know, because as I said, I got good family support, and my daughter being a pathologist, I mean, you know, she would have she explained a lot to me too, you know,
Right.
along with Dr. Tolo, you know, that's not a death can sentence. So it didn't really affect family life. I mean, you know, we made a, you know, we made the best of traveling abroad and so on. What had concerned us is just to be healthy during the COVID period, that we'd get over that operation, you know, safely, you know. But everything went the same, you know, went out as I usual, did all my daily chores, all my recreational activities. No.
Okay. Okay, perfect. Thank you. And the next question is from Michael. Michael, now that we've heard a bit more of John's story, I know you got diagnosed with cancer in 2010. Can you tell us any similarities or differences you see in the process of John's recent journey? Have you seen a change over the years?
The first thing is John mentioned two critical things. We had both been testing prior, which, and I think in my first, in my introduction, I said the whole thing about creating a baseline. The important thing is to have that baseline created where each person, each male, the first time you do a PSA test, that's a blood test for your, the PSA, that's what becomes the marker, your baseline. So every subsequent test is measured against that, whether it stays the same or goes up or goes down. If it starts heading up, increasing the score, then it means there is something happening with the prostate. And let me make the point that not every time that your PSA goes up, it means there's cancer, not at all. As John mentioned, there is enlargement of the prostate, which is a natural function for us men. As you get older, the prostate is inclined to get larger. There might also be urinary tract infections, which with antibiotics, those can be treated. Those two will cause elevation of the PSA readings. So that's the first thing. The early screening is critical. And then secondly, I don't think John and I would ever disagree. The immense support of friends and of family and friends, it is just so critical to your mental state, to just your general well-being, to know that they are there chatting with you, praying for you, supporting you, just checking in on you, you're okay. Come man, I mean, some of them will do it in different ways. That them just say, boy, a long time we just sit down and listen to some music or go somewhere your favorite place and you just go and you just chill out, and that's good. And I tell you, it even afforded me the opportunity to talk to some of my other male friends, you know, about the screening and getting things on track with your general health and putting your life in order as you go, you know, as you get older. It's just something all of us have to do, male or female.
Right.
But the path is similar to very similar to John's. also did a radical prostatectomy, which for the person listening for the first time, it just means you take the prostate out.
Mhm.
Mine was very, very aggressive when they did the biopsy. And we have that in common too. Dr. Tolo, he's a great guy. I elected to go overseas and do the radical robot aided also, just as John did. And no complaints, really, no complaints. But I do want to make the point that every male has a completely different journey, because it depends on the age you were, your physical state of health. You know, if you had been monitoring, in other words, screening, if there is a problem with the prostate, that it's diagnosed early, the earlier the better, because you can always do something about it if you screen early. Always. Where there's a problem is there's no screen and it's caught late, and it's whatever the condition is, whether it's an enlarged prostate or even a very serious urinary tract infection. When it's caught, any of these things that are caught late, you know, it takes a lot longer, and it's more difficult to resolve. Mm-hmm.
Thank you so much for that response and letting us know all those tips. For both of you, I want to ask, what advice would you give to anyone who just got their diagnosis? You know, if you could go back in time and reassure yourself something, or, you know, you have some friends that are asking you about to start the process, what would you say to them?
John, you want to take that first?
Well, what I would say to them, discuss your, situation thoroughly with your urologist. He will tell you the different options, and do a lot of reading on the options. Get second opinion, from another urologist if you can. But speak to friends. I call Mike and ask him certain questions. Speak to friends who went through that already, so that you can be prepared. Yeah.
And my answer to that is ditto, exactly what John said. And add to it your significant other. Once you've spoken, in fact, I suspect he might have had a similar experience to mine too, in that once you're diagnosed, the urologist would and should bring in your significant other, that's your spouse, your girlfriend, whoever, and sit down and have that dialogue with you, probably alone. When I say alone, you, the patient, and along with you, your spouse and the specialist.
Right.
And and then you read, you look at all the options, discuss it amongst you, because there will be changes. I'll tell you straight out. I mean, the doctors will tell you, if the greatest fear, and I know it is with us men, what it will be like after. And I tell you, when you get the diagnosis about that you do have prostate cancer, if that is the problem you do have, you don't think about anything else except staying alive, first and foremost, right, John?
Well, that is true.
After that, when people start healing, they start thinking about their sexual performance and all of that.
Yeah.
And some people go with the expectation that things will probably be better or as good as when already before they got to the stage of the cancer, they were probably at 70% of what they used to be when they were 30 years old or 40 years old. So, they're the expectations and the reality. So you just have to do the checks early and follow the procedure. And then you do exercises before, during, and after. Your mental, social, emotional, physical, and spiritual health is critical once you've been diagnosed. You have to get all of those in place, and it's very, 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 and that's what makes the support of family and friends so crucial.
And I must reiterate what Michael said. The significant other is very important, because my wife was there when we spoke to the doctor that very first time, and that's where the support started.
Well, thank you so much for joining us, both of you. This is all the time we have for today. Bye.
Thank you.
Bye.